This is a Whitehall Street bound W local train. The next stop is Times Square, 42nd Street.
Stand clear of the closing doors, please.
I'm a licensed clinical social worker. I'm the director of Breaking Ground's Street to Home Manhattan, which is Breaking Ground's outreach program here in Midtown. Prior to that, I worked in substance use research for a number of years at Columbia Medical Center, and I'm a therapist outside of this and an adjunct professor at Fordham University, cognitive behavioral therapy, crisis intervention, that kind of thing. So homeless services has been my main focus for quite a few years. I also live in the area, so I've got a personal investment in what happens here in this community. Breaking Ground is a nonprofit organization. In addition to providing outreach services here in Midtown, they also cover all of Brooklyn and Queens. And their main business, I would say, is providing permanent supportive housing, which we were just talking about a moment ago. So we've got over 20 buildings in most boroughs, providing about 4,000 units of supportive housing. What I mean by that is wraparound services for folks, psychiatric services, medical services, case management. We've got art therapy, we've got a dance program at one of the buildings. Basically whatever we can do to keep people in housing. As far as the outreach portion, Manhattan is covered by an overall group called the Manhattan Outreach Consortium that's funded through DHS, the Department of Homeless Services. Breaking Ground is one of 4 programs that covers the island. The others are Goddard Riverside and CUCS. So we cover the north side of 23rd Street up to 59th Street, river to river. So essentially, I would say the most dense area in the city for homeless conditions. We operate 24 hours a day, 365 days a year, and we've got outreach teams on the street canvassing the entire catchment area, going to highlighted priority locations, participating in cleanups of encampments and locations where there's a lot of property or debris, and responding to 311 calls within an hour is our intention. So if you use the 311 app or you make a call to 311 and report a homeless condition in that catchment area, Breaking Ground is a team that's going to respond within an hour. We've also got a dedicated team of case managers. So essentially we engage with folks, we meet them at their street locations, we add them to our caseload, and then they've got someone who's carrying a small number of people and is really focused on getting them off the street as quickly as possible. That doesn't look the same for everyone. Some folks, the traditional shelter system, that works for them. Other folks are going into stabilization beds or safe havens, which is the model that I would say we rely on the most frequently. So in addition to the permanent residences, Breaking Ground operates safe havens in Manhattan and Brooklyn, as well as a drop-in center in Queens. And what that means is folks can come in, there's no curfew. They can be out for a couple days, they don't lose their bed. A lot of these intensive supportive services are available on site, and then we work in collaboration with those safe havens to move people into some of the permanent supportive housing units that we operate, in addition to other providers in the city. What we found is when people go into permanent supportive housing, after a year, 98% have not returned to the street, which is a number that it's quite high. We're trying to get it as close to 100 as we possibly can, but what we found is it's a system that works. It's not always a fast process. The DHS statistic is for folks that are out on the street, long-term entrenched, it takes about 250 engagements before they're willing to come inside for the first time. What we see here in Midtown is a lot of substance use, a lot of severe persistent mental illness, and a lot of medical vulnerability. And oftentimes with our most entrenched folks, it's all 3 at once. So in addition to our outreach teams and our case managers, we also partner with Janian, which is a medical provider, and we have mobile psychiatry teams and mobile medical teams that will go out and provide that treatment to people on their street location. So essentially we'll meet them wherever they are at any time to try to provide these services, build the relationships, and get them to come inside. That's a good question. I would say that trauma is the underlying issue with a lot of these folks that are out on the street for a long-term basis. A lot of folks have had trauma in their own personal lives. A lot have had traumatic experiences within the service system that exists in New York. New York City's got the most robust social services network in the country, but not all of it is the right fit for each individual. And I think once someone's had that kind of experience, it can be tough to convince them to come back in. There is also a shortage of these kinds of beds. So the safe haven beds, while there are many more than there were even 2 or 3 years ago, and facilities are continuing to open every year. There's one slated to open on 14th Street within the next year. There's still a lack of those beds. And sometimes folks will stagnate there as well because the permanent supportive housing that I would argue is the true solution to homelessness. You need homes to put people who are homeless to solve the problem. That's your biggest issue. A lot of folks have just been engaged over and over again, but they don't want what's being offered. I would say a lack of affordable housing is the #1 thing driving homelessness both in New York City and countrywide. This is a conversation that we're having with a lot of the stakeholders in this area. So the community boards, groups like the council here, Corey Johnson's office, and some of the other political groups as well. We've got a dedicated team in the Macy's at Herald Square that does outreach there on a daily basis as well. So we've got business stakeholders, real estate developers, a big group of people who are all in this together. And yeah, I would argue that that lack of affordable housing and fixing that somehow is what's going to bring the most people on the street. We're constantly seeking out new property to develop and other partners to provide social services if we don't provide them ourselves. It's kind of the other arm of the organization. We do not put people on buses to other states not knowing if they have a place to go. And that's not just a New York City problem. I would argue that we're in a national housing crisis right now, but you really, you see how condensed it is here. It's essentially impossible for lower income folks, and particularly the folks that we work with, to be able to get inside independently.